It is called the healthcare crisis no one is talking about. And, Mr. President, I would ask unanimous consent that this be allowed into the congressional record.
Without objection.
Mr. President, thank you. Mr. President, the United States today faces a major health care crisis. I think we all understand that. And in the midst of that health care crisis, we face an even greater crisis in primary health care. And that means that there are many, many millions of people, not just people who don't have any insurance, not just people who are underinsured, people even with decent insurance cannot get to a doctor's office when they need to because there are not sufficient number of primary care physicians in their area. This is a major crisis today, but unless Congress acts immediately, that crisis is going to become much, much worse. Millions of Americans are at risk of losing their access to health care because Congress has still not renewed funding for the Community Health Center program, which expired on September 30th. So we hear a whole lot of discussion about a whole lot of serious health care problems. This is one that we do not hear very much about, and that is Congress has still not renewed funding for the Community Health Center program, which expired on September 3rd. And unless we renew that funding immediately, some 70% of funding will be lost. 70% of funding for community health centers will be lost. The doors of 2,800 service sites will close, and 9 million patients will lose access to the health care they currently have. 9 million people will find that when they go to a community health center, that center will no longer be able to treat them. This clearly is unacceptable. Mr. President, our nation's community health centers provide affordable, high-quality health care to more than 27 million Americans in every state in this country. 27 million people. This includes, by the way, in terms of community health centers, not only primary health care, but also dental care, which is a major crisis in this country. Very hard, many parts of America, to find affordable dental care. Also includes mental health counseling, another major issue, especially within the context of the opioid and heroin epidemic that we face. And in addition to all of that, community health centers provide low-cost prescription drugs at a time when many Americans cannot afford the medicine that they need. So they play a vital role in community after community, state after state, in providing health care to some 27 million Americans. For the 13 million rural patients served, community health centers often are the only health care provider for hundreds of miles. In rural America, there are deserts in which Americans cannot access a doctor, and community health centers are the oasis in that desert. And in addition to all of that, community health centers often provide a lot of good jobs in underserved communities that need them the most. Mr. President, community health centers not only save lives, they also save money. Every dollar we invest in strong primary health care saves us dollars in the long run. Instead of people ending up in expensive emergency room care, and emergency room care is the most expensive primary care in the country, or ending up in the hospital because they can't and do not go to the doctor when they should, community health centers provide the primary care that people need at a fraction of the cost of an emergency room. Medicaid, in many cases, will spend 1/10 as much per patient for a community health center visit compared to an emergency room visit, 1/10 as much. So it is an opportunity not only to provide good quality care, but to save substantial sums of money. Compared to other providers, community health centers save on average $2,371 per Medicaid patient, and up to $1,210 per Medicare patients. What's more, community health centers have played a pivotal role in generating more than $49 billion in savings to the entire healthcare system. They provide quality primary health care. They save money by keeping people out of emergency rooms or keeping them out of the hospitals. Mr. President, not only do we have to renew funding for the Community Health Center program, we must also improve and expand the National Health Service Corps, which is a program that provides debt forgiveness for young doctors, nurses, dentists, mental health providers, and pharmacists who are prepared to work in our nation's most underserved areas. Without debt forgiveness, without telling young graduates of medical school who often leave school $200,000, $300,000, $400,000 in debt, without giving them the opportunity to get those very large debts forgiven, it will be very, very hard to attract physicians and nurses and psychologists to rural areas or urban areas where we have a significant underserving in terms of medical care. And so we need to fund not only community health centers, but the National Health Service Corps. We currently have 1,100 National Health Service Corps members who are in school or in residency programs who will not be able to complete their training and become primary care professionals. So we need to provide the workforce for community health centers and other underserved areas in this country. Now, here is the very good news. The truth is that for many, many years, community health centers, which are playing a vital role all over this country in urban areas and rural areas, have received bipartisan support. And I know that a lot of the bipartisan efforts of the past have kind of disappeared in the current political climate, but I am very happy to say that there is a very strong piece of legislation introduced by Senator Roy Blunt, a Republican from Missouri, which has a number of Republican co-sponsors on it. My own view is that I think that every member of the Democratic caucus would sponsor it, but I think there is a whole lot of Republican support for this community health center bill. So not only is Mr. Blunt the sponsor of the bill, we have Senator Capito, Senator Gardner, Senator Collins, Senator Wicker, Senator Fisher, Senator Bozeman, Senator Murkowski, and Senator Cochran, who are all Republicans on board this legislation. And I believe that if that bill came to the floor today as a standalone bill, it would pass overwhelmingly, because people in rural America, people in urban America, Democrats, Republicans, Independents understand the very important role that community health centers are playing. What this bill is about significantly is funding for 5 years, not quite at the level that I would like to see, but at about 4% a year, which in terms of medical inflation really means level funding. Now, that is in contrast to a bill that is being discussed in the House, which is simply not satisfactory. The House bill is talking about 2 years of funding, and which means it is level funded, which means that really it is a significant decline in real dollars for community health centers. Also, there are pay-fors for the bill which are totally unsatisfactory. It's a question of taking money from Peter to pay Paul, taking money from very important health care programs to put money into this important program. Mr. President, it is widely acknowledged that we currently have the most wasteful, inefficient, and expensive health care system in the world. Despite spending almost $10,000 per capita on health care, that is twice as much as any other country. I just returned from Canada the other day. They spend about 50% per capita of what we spend. They guarantee health care to all of their people, and many of their health care outcomes are, in fact, better than they are here in the United States. So we spend a whole lot of money, and we're not getting particularly good value. But one of the areas where we are getting good value is in the area of community health centers. So, Mr. President, we need to not allow a bad situation to get worse. We have a very serious crisis in primary health care, dental care in this country, certainly mental health counseling. We are in deep trouble. And if we do not fund immediately the Community Health Center program, the National Health Service Corps, and the other workforce programs, a very bad situation will become tragically worse. We cannot tell millions of low-income and working people in every state in this country that they will no longer be able to access the health care, dental care, mental health counseling, and low-cost prescription drugs they desperately need. We cannot tell pregnant women that they will not be able to get the necessary prenatal care they require in order to deliver healthy babies. We cannot tell so many people, the tragic number of people who are struggling today with opioid or heroin addiction, that there is simply no treatment available to them, because community health centers do a lot of that treatment. We cannot tell chronically ill senior citizens that they will have to survive without the prescription drugs that they have used for years. We cannot force community health centers, which provide some of the most cost-effective health care in this country, to lay off doctors, lay off nurses and dentists and administrators who keep these centers going. Historically, the Community Health Center program has enjoyed widespread bipartisan support, and I'm glad to say that for this program, that support continues. So what I am asking today is for strong support for the blunt legislation. Let's get it onto the floor of the Senate as quickly as we can. Let's pass it. Let's demand that the House work with us to pass strong legislation. The time for delay is over. Congress must act immediately to fully fund the Community Health Center program, the National Health Service Corps, and the Teaching Health Centers program now, today. We know that these programs work. We know they save money and lives. These programs must be funded for 5 years, which is what the Blunt bill does, and we should not continue to ignore this very serious problem for another day. And with that, Mr. President, I will yield the floor.
Will the senator withhold? Under the previous order, the Senate